Good evening, everyone. Welcome to today's free community webinar, Addiction and PTSD, Managing the Pathways, where we'll delve into the complex interplay between addiction, mental health, and post-traumatic stress disorder. My name is Tracy Duncan, and on behalf of the team at Fearless, thank you so much for joining us. While everyone is logging in and getting settled, and before I hand over to our host and board director, Garrick, just some general housekeeping and announcements. As always in our webinars, we welcome any questions you may have. Please comment in the Q&A section, and we hope to have some time at the end of the session to answer those. We'll also be recording this webinar, and a link will be sent to all registered attendees in the coming days. So if you're unable to attend this event live and need to duck off early, you're still able to view the recording at your own convenience. Fearless is a charity run by volunteers. We're always grateful to receive donations, no matter how small, to continue the work we do. Our vision is to restore control to people living with post-traumatic stress. Donations can be made via our website, www.fearless.org.au. You can stay connected with Fearless socially on Facebook, Instagram, Twitter, and LinkedIn. This is where we provide updates on any upcoming webinars and events, so please be sure to follow us. And finally, the content in today's webinar is not intended to be a substitute for professional medical advice or treatment. You should seek the advice of an appropriately qualified healthcare professional before making decisions about your own circumstances. You should not disregard professional medical advice or delay seeking it because of the information contained in today's webinar. Okay, let's get started. Good evening, Alex. I'll now hand over to you.
Thanks very much, Tracy, and welcome everyone. Before we start, I'd like to acknowledge the traditional owners of the land here where I am in Canberra, the Ngunnawal people and their elders past, present and emerging. Welcome again to tonight's seminar. My name's Garrick. I used to be the CEO of Fearless and now a director, one of the many directors on the board. And I'm delighted to be able to introduce you to Dr. Anastasia Hronis, who will be presenting the main part of the webinar tonight. Anastasia is a prominent psychologist. She's also an extremely talented pianist and has worked extremely hard on the issue of addiction. She's also one of our ambassadors, and in the time that I've known her, I've been obviously following her quite a bit on the work that she does through her work. And the incredible amount of effort she's put into developing capability around some of these issues. So it is an important issue. It's one very close to my heart because my father also suffered from an addiction, and it caused a lot of stress in our family in the years before he died. So I hardly understand some of the issues and problems associated with this incredibly important issue. So without much further ado, I'm now going to hand over to Anastasia. There will be an opportunity, as Tracy said, to ask questions, and we'll have a fairly decent question and answer process at the end of the presentation. So over to you, Anastasia.
Brilliant. Thank you, Alex, and thank you to everyone at Fearless for having me present this webinar this evening, but also for having me as an ambassador. I'm a big believer and supporter of the work that Fearless do, and really passionate about raising awareness and being able to provide treatment options for people who are experiencing trauma or PTSD. This is a topic that's particularly close to my heart. It's a lot of the work that I do as a clinical psychologist. My main area of clinical practice and also research is in the area of addiction. I have a specific focus in some of my work on gambling, but do work across the board of addiction broadly. And I think this is a really fitting topic for us to be talking about, because I would say from my clinical experience that the majority of people that I do see coming through the clinic and the services who are experiencing concerns with addictions do have some underlying trauma, and the two really do go hand in hand. And it's very hard for us sometimes to just treat one without treating the other, or address one without addressing the other. And so for that reason, I think it's really important that we're able to look at how both addictions and trauma impact one another, and potentially keep people stuck in cycles and in loops as well. I'm going to be talking through a bit about what an addiction is, what we're talking about when we refer to trauma, as well as PTSD, the difference between those, and essentially some of the treatment options that are available. Happy to answer questions at the end. Alex and I will have a bit of a back and forth and chat and hopefully able to answer any questions you have. As Tracy said earlier, this doesn't substitute for professional advice. If you are seeking out treatments or you're thinking about it, hopefully this is a first step, but always tailored care is best. So please, don't hesitate to reach out to a GP, a psychologist, a psychiatrist, a counselor of some sort, so that you can be getting the tailored care that's going to be best for your situation. I am also going to be talking about things that may be potentially triggering for some people who are listening. So we're going to be talking about addictions. We're going to be talking about trauma. And so if at any point in time you're feeling any level of discomfort, please feel free to just, step away from the computer screen, do what you need to do to look after yourself and re-engage when the time feels right, if it feels right. So I am just going to share my screen because I have a few slides, and then we'll reduce those at the end and get into some questions and a bit of a chat back and forth. Okay, so if we start off with the basics, what is an addiction? What am I referring to when I talk about someone as having an addiction? So as a psychologist, we work according to what is called the DSM, Diagnostic and Statistical Manual of Mental Health Disorders and Conditions. An addiction, broadly speaking, is essentially when a person develops a very strong physical or psychological urge or compulsion to do something or use something repeatedly. Now, when I'm talking about addiction, I'm really talking across the spectrum here. So we can be referring to drugs and alcohol, but there's also a number of behavioral addictions that we can think about as well. So things like gambling, sex, pornography, shopping addiction, video games, social media. There's a whole range of things that we actually can become addicted to. And I will talk about the process, and the role of dopamine in this in a moment. But I'm really kind of talking across the spectrum here. But whatever substance or behavior we're referring to, there are some key features as to what defines an addiction versus something that we might have a bit of an unhealthy relationship with, but it's not really quite an addiction yet. So some key things to look out for, whether that's within yourself or amongst a loved one, if you're concerned about their use. So one thing is that a person will start to take a higher dose of whatever the substance is. So say if I'm talking about alcohol, it may be that a person needs to start to consume greater quantities of alcohol in order to feel the effect that they're seeking from it. In other situations, it might be that they're using this substance or engaging in the behavior more frequently. So in the context of gambling, for example, it may be that someone is spending more money, but it may also be that they are gambling more frequently than they previously were. So we're thinking about quantity, but also how frequently someone's engaging with something. Now, this happens because a person starts to build essentially a tolerance. So the initial feeling that I was getting either from gambling or say drinking alcohol, I'm no longer getting that because my body has built a certain level of tolerance. And so I'm needing a greater amount in order to feel that same feeling. Another key feature of an addiction specifically that we find when we're working with clients is that they may have had some attempts prior to seeking professional treatment, some attempts to stop or reduce their use, but those have been really hard and at times often unsuccessful. And so they've had what we would refer to as maybe lapses or relapses, where they've really tried to sort of, stop smoking or stop drinking or stop gambling, but because of what's going on physiologically in the body and psychologically in the mind, that's been really hard. People also experience what we refer to as cravings and urges. So basically, if I have a period, and that period might be a few hours or a few days where I haven't done that thing that I want to do, I haven't gambled, I haven't drunk, I have a physiological urge and a psychological urge to re-engage with that. So to drink more or to gamble, for example. And if I'm unable to do that, if I'm unable to maybe access alcohol, I may go into what we refer to as withdrawals. So my body starts to withdraw because I haven't been able to do the thing that is part of my addiction. eventually what ends up happening is that that person starts relying on that behavior or that substance to not sort of just have that feeling of escape or feel good, but actually to just feel, I'm going to use in quotation marks, normal or stable or okay, or just get by day to day. So it becomes really a source of reliance for them to just be able to sort of get through life. We also kind of think in terms of mental health diagnoses and problems. I often say to clients, something is only a problem if it's a problem. So what we see with someone who has an addiction is that their use might start to impact other areas of their life. So for example, if I'm referring to gambling again, I might find that not only is a person sort of gambling more than they would like to, but it's maybe starting to have an impact on their relationship because they're spending less time with the people who are important to them in their life. Or they're spending time with them, but they're placing bets on their phone at the same time. Might start to impact their ability to focus on work. It might start to impact their ability to sleep. So suddenly this sort of behavior or this substance starts to have an impact on other areas of a person's life as well. And for us, that's a sign that, you know, this has become an issue for someone that really sort of needs to be addressed. So there's some of the sort of key features of what we mean, or what I mean, I guess, when we think about what is an addiction. How does an addiction start? I'm often saying to clients that, you know, there's no 5-year-olds out there going, when I grow up, I, you know, want to have an alcohol addiction, right? Nobody plans to have an addiction. This is not part of anyone's life. It's not part of anyone's plan. There are certain people who are more at risk of an addiction, but it's really something for us to keep in mind that these things often start slowly but can build quite rapidly and quite quickly. So substances and behaviors affect a particular part of our brain that is related to the reward center. You may have heard about a neurotransmitter that's called dopamine. So dopamine is very much related to how an addiction can develop and then also be sustained. So dopamine is often thought of as kind of like the pleasure chemical in our brain. It's the thing that makes us feel good, which it is. But dopamine actually does a little bit more than that. Dopamine is involved in motivation as well as pleasure. So dopamine actually has a really key role in me seeking out something that might make me feel good, as well as making me feel good about it. So these substances, say alcohol or gambling, what happens is when I engage in them, I might have some sort of release of dopamine. But then what happens over time, the more and more I use them, my body and my brain goes, well, I'm getting enough dopamine release because I'm engaging with gambling or drinking or whatever it might be. So my brain goes, I don't need to produce as much dopamine naturally. So my baseline level of dopamine will actually decrease because I'm getting it from, say, the gambling or whatever addiction I'm involved in. What that means is because my baseline has dropped, I then need to keep using that thing or engaging in that behavior to just have some sort of stable level of dopamine that keeps me feeling okay. So in this way, not only do we have a kind of psychological component to the addiction to keep seeking this thing out, but actually in terms of our neurochemistry and how our brain works, there is that really strong desire to re-engage with the alcohol or the drugs or the smoking or the gambling, because without it, I have a very low level of dopamine, which means I don't feel very good at all. So we keep using it to feel, again, in quotation marks, normal, whatever normal means for me, whatever kind of okay feels like for me. So this can be really important to understand, because when we do go through helping someone through an addiction, it means that there will be a period of time where they really actually don't feel particularly good after stopping using whatever it is that they're using, because it takes time for that baseline level of dopamine to come up to its normal baseline level that it was before. Okay. So we've been talking a bit about addictions, but how does this relate to trauma? Because, you know, as part of Fearless, we're here talking about trauma and PTSD. I want to, you know, I've already said that the two of them very much go hand in hand, but I really just want to kind of focus for a moment on this notion of PTSD versus trauma. Often these two words are used interchangeably, but there are actually a few differences between them in terms of what we mean. So PTSD stands for post-traumatic stress disorder. And in terms of our diagnostic and statistical manual as psychologists, there are a very specific set of criteria that define what PTSD is. So that means that someone has experienced a traumatic experience in their life or have witnessed a traumatic event occurring, and they have some very specific symptoms, many of those which are what we would call re-experiencing symptoms. So these are things like experiencing flashbacks, having nightmares where I'm somewhat reliving a variation of the trauma through the nightmare, having experiences where I feel like I'm back in that traumatic experience. And this has a lot to do with how trauma is encoded in the memory parts of the brain. And we do work around this through treatment. So PTSD very much involves those re-experiencing symptoms. Now, a person can have trauma without having PTSD. So what I mean by that is a person can experience, for example, emotional traumas. Perhaps someone early on in their life has experienced some sort of emotional invalidation or neglect from people in their family. That is an emotionally traumatic event that leaves an emotional scar, but a person may not have those flashbacks, those nightmares, those re-experiencing symptoms. Those are very specific to PTSD. So there are different ways in which we can define what trauma is. And I just want to bring attention to that because in the context of addictions, we're talking about both PTSD and trauma that maybe may not fit the PTSD criteria, but is certainly valid trauma in and of itself. So addictions and trauma can often co-occur. And what many people report who have been in these scenarios is that the addiction can actually be a way to escape from the pain of the trauma, whether that be I'm having nightmares and I can't sleep, and so perhaps drinking alcohol before bed helps with that, or whether it be I have emotional pain when I'm in relationships because of past emotional traumas that I've experienced, and that gets triggered up in my interpersonal relationships, whatever the trauma may be. Using substances or particular behaviors can serve as some sort of escape. And over time, this is how an addiction can form for someone who has that trauma history. Now, the statistics tell us that nearly 3 in 4 Australians will experience some form of potentially traumatic event in their lifetime. Only about 4.5% go on to develop symptoms of PTSD. Now, keep in mind that PTSD is a very specific set of criteria. That doesn't necessarily mean that people won't have trauma of some sort, but the PTSD criteria is very specific. But when we think about people who are in addiction treatment and recovery, we know that rates of PTSD are as high as 50 to 60%. And that many people who have an addiction have had exposure to trauma and often repeated exposures to traumas as well. So the impact of these traumas is cumulative and it's quite lasting as well. I've just put a link to a website if you are interested in reading more about this, but also looking at treatment options. This is actually a service that's based in Victoria called Turning Point. They have a lot of good resources on their website. So I will just point you in the direction of Turning Point if you are interested. So again, coming back to, we can conceptualize the development of an addiction. Certainly no one's starting out with the view to have the addiction, but over time it can develop into addiction. If someone is finding that, going to the local RSL club and playing the poker machines is a form of mental escape, psychological escape from the trauma that they're experiencing that might get triggered up in their day-to-day life. We also find that someone who has trauma may experience greater difficulties with what we would refer to as emotion regulation. So my capacity to sort of regulate my emotions day to day in life as things arise. And so this form of escape through a substance or through a behavior serves essentially as a coping strategy. So really, we can think of an addiction in the context of trauma as a coping strategy that has sort of gone too far and is no longer actually helpful for that person. So if we have someone who is coming to us for treatment and then they stop or reduce using that substance or engaging in that behavior, it is very likely that their symptoms of PTSD will reemerge. So it may be that, you know, while someone has been drinking or has been engaged in particular behaviors, that their symptoms of PTSD have been somewhat managed. But if we were to take that away, we would expect that those symptoms would reemerge again. And so a big part of treatment and therapy is helping a person kind of cope with those symptoms, but also process the underlying trauma, which we'll get to in a minute. So the two problems can almost sort of perpetuate themselves, because if a person does sort of try and withdraw from, again, I'm going to use gambling as an example, and those PTSD symptoms emerge, but they don't have the skills to cope with them, it's very likely that they might be drawn back to that addictive behavior or substance. So it's really important for us as professionals to be able to identify if trauma is co-occurring with an addiction, because treating the addiction alone won't actually help the person recover in the long run. We have to treat both the addiction and both the underlying trauma. I do want to speak a little bit to the impact on family and friends. So I'm going to assume that many of the people in the room may have their own personal experiences of either addiction or trauma or both. But there may also be people who are in the online room are listening who have family and friends who may be struggling with an addiction in the context of trauma and PTSD. We know that for someone who is experiencing an addiction, it really can be all-consuming. And this can have a significant impact at times on family and friends, particularly in financial ways. That person might, there might be financial impacts for families if a person is actively engaged in some sort of addiction, but also there's an emotional and psychological impact as well as relationship stresses. I always recommend if there is a family or friend who is trying to help a loved one, for them to engage in some sort of support themselves, whether that be through counselling or support groups. There are professional supports that are available. We often might see that a person who's a loved one of someone with an addiction and trauma might really be kind of desperate to get this person some help and help them through what they're going through. And sometimes this can be really helpful. Sometimes it can have the opposite effect, where a person is really trying to change someone, but they're not ready for that change. So these are really important things for a person themselves to be able to talk through with supports or with professionals. And those services are out there, and I've got a bit of a list at the end as to places that you can look for that. But I guess I want to just, if nothing else, take this moment to kind of validate that it's hard for the person going through it, and it can also be hard sometimes for the people in that person's life as well who's experiencing the trauma and the addiction. I'm just putting these statistics up there to give a bit of context to this. We know that for every person who experiences a diagnosable problem with gambling, that there are 6 people in their life who are impacted or affected in some way. We know that for everyone who kind of falls in that at-risk category of gambling, that there's 3 other people in their life affected. And for every one person who might be kind of lower risk with gambling, one person in their life might be affected as well. So a little bit about treatment, and then we might sort of open it up for some questions. If anyone has any questions, please feel free to put them in the chat box as I'm going. I can answer them as I go, or we can sort of talk through some points at the end, Alex and myself. But I want to talk a little bit about treatment options at this point, because that's usually the questions that we get from people wanting to kind of know what that process looks like. I do a bit of work for the Victorian Responsible Gambling Foundation, and one of the requests we often get is, people who may not have yet engaged in therapy or in treatment, kind of wanting to know what that might look like for them. So if we are working with an individual who has the experience of both trauma and an addiction, the general strategy that I personally would use, and that the evidence suggests is effective, is first we address the addiction, and then second we address the underlying trauma. The reason for this is that if we try to do work surrounding someone's trauma or PTSD while they are still engaged in using a substance or engaging in a behaviour, the trauma work is likely not going to be particularly effective. So there are generally two different kind of avenues that people can go down when trying to work with an addiction. They can either go down a period of abstinence, so not using or not engaging in that behaviour at all, or they can go down the path of what we refer to as harm reduction or harm minimization. So this is essentially where a person might continue to drink or continue to gamble or continue to smoke, but their aim is to reduce how much and how frequently they're doing it, and reduce essentially the impact that it's having on their life. There is evidence to support both of these pathways, but I would say that we find that for people who have more long-lasting and more severe addictions, that the path of abstinence in the long run can be more effective for them, and that the harm minimization approach can sometimes be a bit more of a slippery slope for that addiction to escalate again. So ideally, we would want someone to have a period of abstinence or harm reduction for at least 3 months before we start doing any sort of trauma processing work. And during these few months, a person is essentially building skills to be able to manage stresses in their life, cravings, urges, symptoms that might arise, feelings that might arise that are difficult to deal with. So it's really about what we would refer to as building skills, a lot of strategies at this point in time. So one of the types of therapies that we might do is something called dialectical behaviour therapy. I just realized there's a slight typo in that on the slide, but DBT, or dialectical behavior therapy, if people are interested, you can look further into that. It's very effective in helping people build the skills to manage both trauma and addiction, cravings, urges, and stresses that come with that. Once a person has a period of stability with that, they're able to effectively use strategies. We would then move into doing some of that trauma processing work. And there's a lot of different ways that can be done. Trauma-focused CBT, schema therapy, narrative therapy. There's different options out there that are worth talking through with a professional as to what would be best for you. That's sort of the second stage of the treatment. So I might at this point kind of open it up for a bit of questions, a bit of chat with Alex that gives you a bit of an overview as to addictions, trauma, and kind of treatment options for both. I've just put a couple of links of different programs and services that are available. They offer different things, but there are these and more options available depending on your local area as well. But at this point, maybe Alex, do we want to see if there's any questions?
Yeah, I'll allow people to start putting them in, but I've got a number of things to talk about. So,
okay.
So thank you for that. I don't know where to start actually. I'll start with this one. Probably about 6 months ago, I saw something on Twitter, which is called X Now, whatever it's called, and there was a debate around addiction and children, and there was a debate on one hand saying, like the general acceptance is that if you suffered a mental health issue when you are a child, you do normally take that with you into adulthood. And then there was this general discussion around whether addiction is the same. Can you have an addiction as a child, and does that addiction filter through as you grow older? Now, there were two psychologists having this battle, one saying yes, one saying no. I'll throw it over to you to see what you say, because I think there's I'm very interested in this, because obviously with that other connection around mental health, I'm curious to know how that works.
Yeah, it's a really interesting one. If I think about how any sort of challenging behavior might emerge for a child, if we think about a child, they have limited cognitive capacity to make sense of the world around them, but also limited ability to cope. So when I have seen many clients who have experienced addictions through their life, it is common that I hear that they may have actually got into either drinking or smoking or whatever it was quite early on, and often in their teenage years. It's not an uncommon story to hear. So for many people, that starts quite early on, but again, becomes progressively worse throughout their life. Certainly, if we think about in the context of children, things they have access to, like video games, we're seeing increasing sort of rates of children having a problematic relationship with playing video games or games on their phone and social media. And again, this can be thought of in the context of this is something that a child has that's available to them that they can use to cope. It's a bit of an escape if, home life or personal life is not ideal, or there are struggles or traumas that young person has experienced. This can be a bit of an escape for them, and that might stay with them. And often what we find as well is someone who has a vulnerability to addiction may actually be quite vulnerable to experiencing more than one addiction, and that might change over time. So a young person might have had a problematic relationship with video games, but later on in their life that might morph into something else.
Yeah, it was interesting because, and I can't remember the exact scale of her argument, but the psychologist was saying actually that social media has become the addiction of the young, and that nobody's really considered that, and the dangers that actually does suggest as a person grows. And when you look at it, I can see what she means in a way, given how many young people are addicted to social media and what that all means, and so forth.
Absolutely. And it's the way in which social media functions. Like many of the, it has been crafted in a particular way that it actually mimics a process of what we call intermittent reinforcement, which is what poker machines use.
Yeah.
So, things like notifications. I actually learned recently that Instagram will do something where once you post something, it withholds likes to keep you going back and checking later, and then kind of releases them in a flood later on. Yeah. But part of what that does is actually kind of keep a person going back and continuing to check. So there are strategies, unfortunately, that social media platforms use, because their biggest, I guess, moneymaker is our attention. And the more attention we give it, the more time we're on these platforms, the more that they earn as well. So, but the process of intermittent reinforcement is very similar to what gets people hooked on things like the pokies. It can be really powerful.
Yeah, no, I agree. No, that's great. Thank you. We have got a couple of questions now that's come in. The first one's from Andre. Hello, team. Can therapy be concurring, or the addiction must be treated first?
So I would say both of those. So you would be doing therapy to treat the addiction. And that therapy can look like a lot of different things. It might be engaging with a psychologist or a counselor. It might be doing some sort of 12-step program. There's lots of different ways, but we would just want someone to be able to have a period of either abstaining from the addictive substance or behavior, or at least significantly reducing their use before we opened up the trauma. And that is because we want someone to have the skills and strategies to be able to cope with what comes up, because trauma processing work can be really hard. And we're often sort of looking at parts of a person's life that they have actively tried to push away, understandably. So we want to make sure that someone has those strategies first before we move into that.
Okay, excellent. Thank you. Now I've got one from Mark. What is dialectical BT?
Yeah, dialectical behavior therapy. So dialectical behavior therapy, or DBT for short, is actually a treatment that was developed for people who have trauma. And essentially it's two phases. First phase is really all about building skills. And once a person has those skills to cope with emotions, to cope with distress, to be able to navigate challenges in their life, you then do the second phase, which is trauma processing work. Dialectical behaviour therapy is also very helpful. Research has been done to show it's not only helpful for trauma, but people who have addictions, people who have eating disorders, and people who engage in more risky or sometimes even life-threatening behaviours. So that's the target group that it's most useful for.
Okay, thank you. Now I've got a question from my good friend and fellow director on Fearless, Belinda Neal. Thank you so much, Anastasia. Can you please advise what to do when you can see obvious signs of an addiction in a loved one, e.g. sneaking, hiding alcohol? What can one do to help if they do not acknowledge that they have a problem?
This is a really good question, and one that we get asked a lot. In the same way that we've had Are You Okay Day, and Are You Okay Day is all about sort of starting and opening that conversation with someone. I think a similar approach can be really useful for someone who is struggling with an addiction. We want to kind of open the conversation gently, and that might be us sort of stating that we notice perhaps that person isn't themselves, or maybe it's, I noticed that you've been spending more time on your phone, or I noticed that you've been drinking more than you usually would. Like, is everything okay? How have you been feeling? What's going on? Would you like to talk? Sort of those general open-ended questions. I think for us, trying to open that conversation, it's important for us to be prepared that someone might shut that down. But I always kind of go, it's important that we've planted that seed, that we have communicated, I'm here and I'm available for when you are ready to talk. If you're ready to talk, and you don't have to talk to me, but I can help you, find the right person to talk to. But we've planted that seed for someone that, hey, we've noticed that, something doesn't seem quite right. You don't seem quite yourself. And if you would like to talk, I'm here when you're ready. But it is, I think just sort of within ourselves being prepared that someone might not be ready at that time, but gently opening that conversation.
And is there any other, obviously going to see a specialist like yourself is one step of that, but are there any other places that people can go to get advice on how to help someone who they suspect has an addiction?
Absolutely. There's a lot of like really credible information online from, government agencies, but also, if anyone has ever been involved in the 12-step program, so that's things like AA, Alcoholics Anonymous, NA, there's many different types. They actually have groups that are for people who are loved ones of someone with an addiction. So, for example, for Alcoholics Anonymous, there's something called Al-Anon, which is for family and friends of someone who has an alcohol addiction. So they can be really good sources of support, if nothing else, and kind of maybe not, the same sort of information you'd get from, a professional, but certainly people who've experienced similar things and may be able to provide that sort of informal support as well.
Mm-hmm. Okay, great. Thank you. I've now got a question from Stephen. Could you please discuss the effects of going cold turkey with addictions such as alcohol, smoking? I should say that I've seen a friend of mine go through this, and I'd have to say it was one of the most distressing things I've ever seen. She just went from being someone that was just bubbly and vivacious. We didn't know that she had an addiction, but when she started the treatment and did go, I couldn't recognise her. It was like going from. It was like seeing the girl from The Exorcist, if you remember that movie. It was just horrendous. So I'd be very interested to see what your answer is with this one.
Yes. The first thing I want to say is, please don't ever try and go cold turkey without the guidance of a medical professional, because particularly in the context of drugs and alcohol, stopping suddenly can actually be life-threatening, and in certain cases can even result in death. The effects of the withdrawals can be life-threatening. So to go through that process of detox, you can go through it either in an inpatient hospital, or there is actually ways to do it as an outpatient under the care of your GP as well. But as you said, Alex, like I'm not going to sugarcoat it. It is a really difficult thing for a person to go through. Physiologically, in terms of how the body reacts, it's really quite unpleasant. But it is a matter of sort of, maybe a few days a week of really going through those quite significant physical effects of stopping using the substance. Psychologically, in terms of how our neurochemicals work in the brain, you won't feel particularly good for a while afterwards. And I think that's really important for people to know, so that they don't have this idea of, I'm going to get off this substance, or I'm going to stop doing this thing and my life will be better. It probably actually won't feel much better for a period of time, and we're going to have to work to get it there. But with supports and with treatments and with work, it certainly can get there.
Yeah. As I said, it was for her friends, it was horrendous. And as you said, I think part of the issue was that she did try to do it by herself, and fortunately, someone stepped in and said, "No, we're gonna manage this under a proper framework," and she was fine. But yeah, it was a scary thing to see. Thanks, Anastasia. The next question is from Mark. Can you please unpack what trauma processing looks like?
Yes. So I'm going to give you a bit of an analogy that I often give clients to sort of explain what I mean when I sort of say, trauma work. Because I think a lot of, this is not uncommon for people to say, you got to, process the trauma, but what does that actually mean? If you imagine you have a cupboard in your house that has just like lots of stuff packed in there in no particular order. It's kind of just shoved in the cupboard, and you close the doors, and it's that cupboard that you don't kind of really want to look at and open. It's just got all bits and pieces in it. But because it's jam-packed so full, what happens is every now and again, you might kind of like walk past, just give it a bit of a knock, the doors open, and everything kind of falls out of the cupboard. This is an analogy to explain what sometimes happens with trauma. So we have memories of trauma that are obviously very distressing. We pack them away in our brain. We don't kind of want to go there. But in day-to-day life, we have triggers that trigger up trauma. And so that cupboard gets opened, and then everything sort of falls out, and we experience this big sort of overwhelming response because of the trauma in our life. So what does trauma processing mean? Trauma processing is essentially sitting with a therapist, opening that cupboard up, gradually pulling out the pieces one by one and putting them back in a kind of nice, neat order. And then we kind of can close that cupboard. We can open it at any point if we choose, but we're not having it opened for us and getting flooded by it. So trauma processing, more often than not, will involve to some degree talking through the traumatic experiences that occurred, not always in full detail. It really depends on what the trauma is, whether someone has PTSD or trauma, and what kind of therapy is needed. But there will be some degree of opening that cupboard.
Okay, excellent.
I hope that provides you with an answer, Mark. Yeah.
Excellent, thank you. We've got some more questions here, so we'll just keep on going. The next one's from Tim, and touches on what we spoke about before around social media. What's the best approach for a teenage girl in addressing excessive social media use, 5 hours a day on average, including school days?
Yeah, this is a good question and a tricky area, because particularly in teenage years, and social media can be such a form of sort of connection with peers and social identity as well.
Also bullying too.
Yeah, yes. Social media is one of those things, like it's a real blessing and a curse, because I think there's a real lot of positives to social media when used in the right way, but also there's a lot of negatives that come with social media too.
Yeah.
I mean, I would be suggesting being able to have a conversation ultimately around limits. I think it can be healthy for a teenager to learn how to have a healthy relationship with social media, but this is maybe something that does require limits to be put in place around not only how much, but when it's used. Like maybe dinner time is not the time where we have phones or devices around where we can be on social media. So I guess being more purposeful and deliberate in using social media versus being engaged in other parts of my life, whether it's homework, whether it's being with friends, whether it's having a meal with the family. So setting boundaries around kind of the deliberateness of use, rather that sort of compulsive, I'm guilty, I have my phone sitting right here, and I am one of the people that turns notifications off, but it can really be quite distracting and a bit of a pull. So looking at the ways to set boundaries around it is what I'm recommending.
And also, I guess some of the telcos offer those services where the parent can actually stop the internet for 2 or 3 hours around dinner, around study. So that those might be options. But look, I actually think this is I personally believe that society has changed so much because of social media. Just in the way that people interact with each other. I mean, without digressing, seeing some of the language that people have been using on social media around the voice and how they've attacked each other and things like that, I just despair, how we got to this point. And but I do. It really is an issue, I think, for young people in particular, because it gives them a false understanding about what life then becomes afterwards. And so, look, I think this is going to be I found this from a PTSD point of view and a mental health point of view very relevant during COVID, and that was going to be my next question, because it seemed to me during COVID I was speaking to a lot of people who were impacted by lockdowns, who lost their businesses, and they were trying to fill a gap. And not only that, with their children who weren't able to go to school for large periods of time, they were trying to fill a gap, and social media filled that gap for the children. But for a lot of people that I spoke to, said that they got their addictions during COVID. Did you see an uptake of that during COVID, or is that something that we just take for granted, that any major social event like a war or COVID, those things will happen?
I think during COVID, people were searching for ways to cope. And so at the time, I was actually working at a private hospital where I was running our outpatient addiction program. And what we found is that we had more people than ever who were relapsing, who maybe had quite a period of time of sobriety, but had relapsed, or who were requiring more support than they previously did. And so it was a interesting but very challenging time for us as the service to be able to provide what people needed. But I think, at a time like COVID, people were searching for ways to cope, and for some people that can come through excessively throwing themselves into something, whatever that may be. It might be work for some people, it might be drinking for others, whatever it is. If we do something in too much, in excess, to a point where it no longer becomes a choice but becomes very automatic and feels out of control, that's when we really kind of start to feel like it's becoming problematic in someone's life.
Yeah, and I guess there's a similar theme there. And sorry, I'll get to the other questions in a moment. There's a similar theme there. I do a lot of work with veterans and worked for Veterans Affairs for a number of years. And a consistent theme with some of the people I met through the system who did develop addictions was that we're in a wartime situation. It's difficult to explain what we go through, and at times the rush that we feel when we're deployed in an operation, and then we come back to Australia and our lives are completely different, and filling that gap is so hard for us that we automatically turn to something else. And I guess that's something, and I guess my issue is really around preventative measures for people like that. Is there a lot of work around prevention, or is it something that we're still tending to work through?
I think there is work around prevention, and I think there's still a lot more that can be done. That needs to be done. Yeah, absolutely. Particularly when you talk about, in the context of veterans and first responders as well. Like, I really think more can be put into the preventative strategies that can be put in place. There's no foolproof prevention, but there's certainly more that can be done, I would say.
Yep, excellent. Okay, thank you. Okay, now from Stephen, can you please discuss beliefs associated with the self-identity as a functional alcoholic?
Yes, functional alcoholic is an interesting term. If I'm speaking very broadly, I would say that a person may appear to be functional in certain parts of their life. So if we're talking about someone who self-identifies as a functional alcoholic, maybe they're able to get up and go to work and sustain a job and have relationships with people, and that seems to be functioning okay on the outside. But I would probably say that there are, other ways in which a person maybe doesn't feel quite fully functional, which is more so that kind of internal emotional level where there is stress or that requirement to kind of have that alcohol or whatever the addiction might be. And so functional alcoholic is maybe sometimes, from what I've seen in clients, an identity that people can attach to that helps them keep using, and that can sometimes be a bit of a defense. And it's not to say that people aren't functioning in their jobs and in their careers, but are they functioning to the degree that they could be, or are they the happiest that they could be, or are they the most content and fulfilled? I would say probably not.
Yeah. Okay, right, thank you. Now Tanya's, I don't think she's asking a question, but she's just notified us around the principles and practice of narrative medicine. And I was actually going to ask you a question myself around this about what that actually is, but did you want to quickly talk about that?
Narrative medicine, I'm not entirely sure what that's referring to, but we have a type of therapy called narrative therapy.
And that's what I was referring to as narrative therapy, yeah.
Yes. Yeah. So again, another type of therapy that's used for people who've experienced trauma, which often involves telling their story of trauma in some sort of narrative form. This can be sort of more factual in terms of how the person has experienced it. It can be sort of more creative in ways, but it is essentially kind of through this storytelling process, a person may be involved in kind of writing that out, recording it. There's all different ways to do it. But again, looking at that trauma and sort of telling that story. And when I say telling the story, in the context of the therapy room.
Yeah, well, I probably can vouch for that myself because I wrote a book about my own trauma. And I did find that extremely therapeutic. And obviously, the first part of it I did in association with my own counsellor, but I did find that incredibly liberating, I guess, in terms of pulling out all the key issues and actually having a. And sometimes when you do it as a story, you don't look at it from a first person perspective. You're actually looking at it from a third person. And it actually helps a hell of a lot. I actually, writing this book in the style that I did, I kept on, well, this bloke had a lot of issues, and I realised that guy was me. So I found it extremely therapeutic. So yeah, if that's a good way of moving forward, then I heartily recommend it.
And that's a really good point, like being able to kind of externalize the trauma from within, right? Often people, not saying that this is justified, but a common experience is people have self-blame, shame, and guilt. And so being able to write out that version of the story of the trauma, being able to put it on paper, see it in that third person perspective, remove some of that for people.
Yeah. But again, as you said, whatever option you take, consult with your medical practitioner or mental health expert on what is the best solution for you. Thanks, Anastasia. Now I'll go down to the last one from Mark. Just a note on trauma processing. I recently have started to call it grief processing and working through the stages of grief with trauma.
I like that. I like that reframe because trauma is not just about the memories that we have of the trauma, but it's also around how has this potentially shifted my view of myself, my view of people around me, my view of the world, the belief systems I hold about life, so many sort of beliefs in how we view ourselves, others, and the world. And there can be a part of that really is kind of grieving certain elements of maybe previous belief systems that we've had, or relationships we've had with people, whatever it may be. So if I really kind of like that reframe. Thanks, Mark.
Yep. So before we got about 5 minutes, and I just wanted to ask you about, obviously this is an issue that, you know, it's in our society, as we talked about before, it's becoming fundamentally more important. You recently attended a conference in Las Vegas, and I was just curious what the international view of where we're going with addiction is at the moment, and what were some of the outcomes of that meeting.
Yeah, yes. So it's very ironic, but the conference I attended is our big international gambling conference that's hosted every years. But the University of Las Vegas, Nevada does a lot of work in international gaming policy, and really some excellent, fantastic work. But you know, there really is this kind of, you touched on it before, but really a shift, a real positive shift to focus more on prevention, from the perspective of kind of public health initiatives and awareness. So how do we get more people to kind of understand perhaps some of the risks of certain things like gambling, like drinking? You know, within Australia, I think we've done good work to for people to understand that someone might experience harms related to alcohol without being an alcoholic. So we have, you know, all these campaigns around don't drive if you're drunk, and you know, make sure that you drink water and you eat food before you drink. But you know, with gambling, we're still to catch up in that area. So I guess one of the key takeaways for me is really kind of this push towards public health awareness, prevention, and stepped care models. So, you know, not everybody needs the most intensive type of therapy. Actually, there are some lower intensity services and self-help kind of things that people can do if they just need a little bit of, you know, guidance and direction, that can really be quite helpful as well.
Yep, excellent, great. Now, KB, I'll say, just mentioned their views about narrative therapy. Yeah, and I agree with everything that they've said there. It is for work for me, obviously, but yeah, no. Thanks for your thoughts there. Now we've got a couple of minutes left. Is there any last sort of point that you would like to make, particularly around people who have got concerns either about their own situation or that of a close family friend? Any other final points you would like to make before we close off?
Yeah, I guess the last thing I would want to say is that unfortunately sometimes shame, guilt, stigma, these things can really sort of prevent someone from seeking help, whether it is for sort of trauma and PTSD in and of itself, or co-occurring with an addiction. And I would really encourage people to either, you know, seek out the support from someone who feels safe in their life, or if there doesn't feel like anyone in your personal life that you can open up to, I encourage you to try the process of seeking professional help. You know, and if the first therapist that you meet doesn't work for you, try the next one, and then the next one, because therapeutic relationship is the biggest predictor of treatment outcomes. So what matters more than anything is how you get on with that clinician that you're working with. And that's going to be hugely successful to your treatment outcomes. So I would encourage people to sort of, you know, I know it's hard, but try to push through that stigma or that shame or that guilt or that self-blame, and reach out for help. There are people there who are available and willing and ready to help.
Fantastic. Thanks, Anastasia. Now, I'm personally grateful by the fact that my Beagle pulled my modem off about 20 minutes ago. If you heard a crash, it was my modem falling off the table. How I'm still on air, I've got no idea, but I'm very grateful that we did survive, and I'm going to kill him in a moment, and my beautiful dog. But look, I just wanted to say thank you very much, Anastasia. It's been an incredible presentation. Once again, I want to thank you for not only being an ambassador for Fearless, but all the wonderful work that you do, not only in this space, but more broadly in terms of mental health prevention and so forth. So I hope that everyone has got something from tonight's presentation, tonight's webinar. It will be available on our website in the next couple of days. I want to thank Tracy Duncan once again for organising tonight, and also helping out with for the next one as well, which will most likely be Simone Reed, one of our other board members on Fearless. But Anastasia, on behalf of everyone at Fearless, from the board, from myself, and from everyone who logged on tonight, I want to thank you very much. And for everyone else, thank you for attending, and we'll see you next time. Thank you.
Thank you for having me. Thank you.
No worries. Our pleasure. Thanks, Anastasia. Bye now.
Bye.